Menopause by Ashley, Gabby, Joanna, Ben, and Jalen.
What is menopause? Menopause is a natural biological process that occurs in the life of a woman which involves in hormone changes. Menopause is considered to occur when a woman has gone without a menstrual period for 12 consecutive months. Estrogen and progesterone means that the hormones that regulate menstruation stops releasing eggs for fertilization. The hormone changes that take place during menopause particularly decline in estrogen and progesterone production by the ovaries, leading to the end of menstrual cycle. Every woman, except those who had their ovaries removed before puberty, will go through menopause. Typically occurs between the age 45 and 55. Now on to history. A French physician coined the term menopause in 1821. His name was Charles Pierre Louis de Gardin. In 19th centuries, physicians and medical practitioners began to recognize and document the symptoms associated with menopause, including observation of change in menstrual patterns, hot flash, and mood swings. In the 1920s and 30s, Edward Adolphe Dozy discovered and characterized various steroid hormones, including estrogen and progesterone. In the early 20th centuries, physicians witnessed the isolation and identification of estrogen and progesterone, which physicians had a deeper understanding of hormone changes during menopause. Hormone replacement therapy gained more awareness in the mid-20th centuries as a treatment for menopause symptoms.
Mechanisms of menopause. Let's start with premenopause. Premenopause dates in the time that a woman is under the age of 40 and has not developed menopause yet. Her ovarian follicles are released ordinarily. As ovarian follicles are released ordinarily, the woman can still reproduce and can have menstrual cycles. Also, her hormones are regulated naturally. These hormones include estrogen, proestrogen, FSH, and LH. Hormonal feedback mechanisms involve the hypothalamus, pituitary gland, and ovaries. And these mechanisms ensure proper regulation of reproductive hormone levels throughout the menstrual cycle. Now on to perimenopause, which is the transition period into menopause. Perimenopause typically begins in a woman's life in her late 30s to early 40s, although the exact timing of this can vary. During the stage of perimenopause, ovarian function unfortunately starts to decline, leading to irregular menstrual cycles and hormonal fluctuations. The hormonal symptoms would be fluctuating estrogen and proestrogen levels, persistent menopausal symptoms such as migraines, vaginal thinning and dryness. Other could be changes in libido, as well as frequent UTIs, as well as a risk of osteoporosis. As a woman gets older, the number of ovarian follicles decline as well. This results in a decreased amount of estrogen production. This decline eventually leads to menopausal symptoms. Now, there are also instances of ovulation becoming less predictable with perimenopause, skipping periods, shorter or longer cycles, and so on. Hormone levels, such as estrogen and proestrogen levels, may fluctuate even more so during perimenopause. Estrogen levels may initially rise due to increased FSH stimulation in response to the declining ovarian function. However, overall estrogen levels gradually decline as ovarian follicles become depleted. Now, alongside depletion of ovarian follicles, which fall under the anatomy and physiology changes in the woman's body during perimenopause, there is also thinning of the woman's uterine lining and changes in vaginal tissue. You can also experience hot flashes, night sweats, mood swings, and sleep disturbances. Last but not least to note about perimenopause under mechanisms is that It's typically diagnosed after 12 consecutive months, irregular menstrual cycles. Now, last but not least, in the mechanisms of menopause, let's talk about menopause. It actually is defined overall after 12 consecutive months without menstruation, not irregular menstruation cycles. Hormonal symptoms include stable, low estrogen levels. They remain consistently low, and this is what leads to menstrual periods being skipped or absent. Another hormonal symptoms include the ongoing menopausal symptoms, such as hot flashes, vaginal dryness, night sweats, mood changes, and other after-mentioned symptoms may continue, although as well they may diminish in intensity over time. Now on to the anatomy and physiology changes in a woman's body during menopause. First, let's talk about the complete halting of ovarian function. So, this can be described as the ovaries stop releasing the eggs as they usually would, and estrogen production significantly decreases. And last but certainly not least is the atrophy of a woman's reproductive tissues in her body. Without her regular estrogen stimulation, the uterine lining becomes thin and inactive. Vaginal and vulvar tissues may continue to atrophy, leading to continued symptoms of vaginal dryness and discomfort. Now, in summary, these three stages are overall characterized by hormonal fluctuations, changes in reproductive anatomy and physiology, and their associated symptoms.
Moving on to special focus, premenopause. Women typically get their period at a young age. This process begins in the hypothalamus. Once it's stimulated in the hypothalamus, it signals the anterior pituitary, which then signals the ovaries and so on. One follicle develops once a month. This is a hormone-producing organ. The lifespan of one follicle is 28 days. Follicle's lifespan will go on until none respond to the pituitary. Perimenopause is the time period where a woman is at their final years of having a period. Postmenopause, this means that the body will undergo menopause itself. It's originated in the ovaries, and this process begins once the ovaries fail. This indicates the body is going through changes due to the inactivity. LH and FSH hormones. When menopause begins in the middle-aged woman's body, estrogen and progesterone, chemically known as carbon 18, hydrogen 24, oxygen 2, and carbon 12, hydrogen 30, and oxygen 2, begins to decrease. In the body, LH, luteinizing hormone, and FSH, follicle stimulating hormone, levels will begin to increase. This is because of the pituitary increases due to the decreasing estrogen and progesterone levels in the body. This significant decrease in estrogen and progesterone will decrease the ovarian function. Increased levels of LH and FSH causes the following symptoms to occur: hot flashes, night sweats, and insomnia, as well as joint pain. These are very common side effects of menopause. The chemical organization process. Showing on the image to the right, you can see all the arrows and everything, and arrows pointing up and down. Up means increasing, down means decreasing. You can see in the interleukin, the IL-1 and 2 beta, these are receptors that indicate pathogenesis of osteoporosis. This can increase the chances of having brittle bones and easy breakage. In this image, you can also see the regular menstruation on the top, and it says the reproductive phase, and you could see the arrows pointing through the life cycle of postmenopause and the remaining of the life and how it becomes late or either early, and the menopausal transition. And then down below you can see it says ovary, and then the follicle count, the estrogens, the FSH, the LH, the inhibit B beta, those are either decreasing or increasing due to the menopause and the women's period stopping and all. And then, unfortunately, when you go through menopause, inflammation factors can come in, such as the IL-1B, that's the beta. And then these receptors indicate the pathogenesis of osteoporosis, and this can increase the chances of having brittle bones and easy breakage, like I stated. And then the TNF, this means the tumor necrosis factor, increases the inflammation. Unfortunately, like I had stated also, it can spread around to the body, and these issues then can set off the immune system to fight against many diseases. That's why a lot of older women may go through more health issues. This may be because of menopause, and scientists are still discovering this to this day. TNF is also a multifunctional, that's known as a pro-inflammatory cytokine. A cytokine is a protein that controls growth in the immune system cells. Since the TNF is increased in the chemical reaction, the body may be more prone to conditions like Alzheimer's and type 2 diabetes, because all of these signals and everything goes to the brain, and then you could see the neurodegenerative diseases also being caused. And then you could see on the bottom the estrogen and progesterone chemical equations here. Like I had stated, a lot of these can cause many more issues in women, and unfortunately, post-menopause, like I said, can cause a lot of inflammation markers to increase, and women may be needing to be on estrogen medications to level out these hormones, so they don't have these many symptoms. You can also see in the image that the blood-brain barrier is compromised, and the activation pro-inflammatory markers, like I said, increases the brain to undergo Alzheimer's possibly and other neurodegenerative diseases. But like I said, going through postmenopause, you're at a higher risk and chance to getting prone to many more diseases, and there may be complications that you may be on medications. That just depends on your history of health conditions and your lifestyle after having gone through menopause. As stated, the chemical organization process begins in the ovaries, and having lower estrogen and progesterone hormones increases the chances of getting other conditions. These LH and FSH hormones remain high for the rest of a woman's life, unless medically prescribed a medication to depress these symptoms. The ovaries signals the brain, and neurological change occurs. Shown as the image, you can see symptoms like brain fog and forgetfulness can occur. That's why Alzheimer's is a really high chance that a woman could get it after having going through menopause in general.
Women going through menopause experience the following symptoms: pain during intercourse because of the thinning of the vaginal tissue and dryness causing pain. They experience irregular periods, which is due to the fact that the ovaries produce less hormones. They experience vaginal dryness. They have issues with their sleep, which is also associated with hot flashes, causing them to have unexpected wake-ups. And they also deal with hair thinning and skin dryness because the estrogen levels are low. The diagnosis of menopause is usually based off of the signs and symptoms, since there's no test needed to diagnose someone, although you can get tested for follicle-stimulating hormone and estrogen, because as FSH increases, the estrogen levels decrease. You can also get tested for thyroid-stimulating hormone because it causes similar symptoms to menopause, so people often get them confused. And then women in the age of 40 to 45 experience early menopause, which occurs to 5 to 7% of the women population.
When a woman gets menopause, they typically don't need treatment because the symptoms usually go away on their own. If they do end up needing treatment, currently the best treatment is hormone replacement therapy. Hormone replacement therapy treatment aims to address the hormonal changes associated with menopause. With menopause, there is an increased production of pro-inflammatory mediators and oxidative stress, which causes the central nervous system to become damaged and causes depression in women with menopause. Oxidative stress and inflammatory mediators plays a significant role in the function of the endocrine system. Currently, the prognosis of menopause is good as long as you live a healthy lifestyle. If you keep smoking and not on a healthy diet, then the menopause won't go away. But as long as you quit smoking, live your healthy lifestyle, and get some exercise in, you should be on the right track.
In addition to treatments, if you visit your primary care doctor, mention estradiol. Estradiol is a medication used to replace the natural estrogen in the body. Since during menopause, your estrogen levels will significantly decrease. Being put on this medication can also help prevent the following symptoms like bone loss, also known as osteoporosis, hot flashes, and any vaginal changes. So I would suggest maybe talking to your doctor about this specific treatment. Many women do take estradiol when going through menopause. Here are the following works cited. I will have these underneath the link on YouTube where you can just click on the links and it'll take you directly to the website.